Hello! Today we're presenting 3 campaigns, 1 goal, community-driven case studies that boosted awareness of diabetes programs. This work was developed through partnerships between ICF, James Madison University, and the CDC, and highlights how locally tailored outreach can connect people to prevention and care for type 2 diabetes. Across the United States, type 2 diabetes burden remains high, yet awareness of proven programs like the National Diabetes Prevention Program, also called the National DPP, and Diabetes Self-Management Education and Support, also called DSMES, remains low. When people don't know these programs exist, access to prevention services and care suffers. Addressing this gap requires more than messaging alone. Partnerships with trusted local organizations help ensure that outreach reflects real community needs and reaches people where they already are. We also recognize that in order to reach the audience, the message and messengers must be tailored to each audience and should reflect the context where the audience lives. ICF partnered with Bingham Healthcare in Idaho, University of Illinois Chicago, and CPESN in New York to develop and deploy audience-centric campaigns to raise awareness about DSMES services and national DPP programs in their community. Although the settings differed, all 3 campaigns shared a core principle. They were designed with communities and for them. The result were 3 tailored campaigns that reflect the unique challenge of each community. Our first example comes from Idaho. The challenge was reaching adults in rural, geographically dispersed communities who had limited contact with healthcare systems. The solution was to leverage a large, well-attended annual community event, Spud Day. Bingham Healthcare set up one table exhibit and encouraged visitors to complete a diabetes risk assessment. Healthcare providers were on site to connect with attendees. With just one table and one day, 24 people completed their type 2 diabetes risk assessment, and 9 of them directly connected to on-site healthcare services. Idaho used flyers to advertise their table at Spud Day. The flyers emphasized the impact that a loss of a parent can have on the family. The flyers helped draw people in and start conversations. In Illinois, the challenge looked very different. The focus was a highly mobile, urban population, mostly Black and Latino, with limited time and limited access to healthcare, daily transit riders in Chicago. A 12-week bilingual mass transit campaign reached riders across buses, trains, and garages. The purpose of this strategy was to intercept their audience during their commute as they moved through the city. Illinois leveraged data to inform their campaign at every step of the way, from data to determine ridership patterns, to feedback from stakeholders to develop the messaging, and QR tagged to Google Analytics to assess reach. The results were substantial. A 103% increase in DSMES program visibility and 63% more active web users. In upstate New York, the priority was engaging adults over age 65, a group at high risk for diabetes complications, but often overlooked by traditional campaigns. The strategy centered on pharmacists as trusted messengers. Pharmacists delivered in-person education and risk assessments in community venues like senior living facilities and community centers. This approach increased intentions to enroll in DSMES programs and request referrals, demonstrating the power of trusted, familiar providers. Several lessons emerged. First, use free or low-cost tools like CDC graphics, Canva, and Google Analytics to help keep the cost of production and evaluation down. Second, let data guide decisions from placement to evaluation. Third, meet people where they are using culturally relevant messages delivered by trusted voices. Finally, lean on trust messengers to enhance acceptance and connections to local services. These campaigns didn't just raise awareness, they created pathways to care. From transit systems to pharmacies to community events, each approach turned everyday spaces into access points for prevention and education. Together, these case studies show that community-driven, scalable outreach can strengthen diabetes awareness and improve health equity. Thank you.